Oncoscope Enterprise includes 3 screens for each cancer. I'm going to show everything for breast cancer. And similarly to Oncoscope Edge, you could just start selecting specific patient populations and the subpopulations within, as I am doing this now. And for example, if I go for HER2 low, and then I don't have to go in order, I could just do this, right? And then click on ADC, and then go to this, the patients without a visceral crisis. As you could see, as I've been selecting, specific boxes with lit up. But interestingly, these 3 are now in turquoise color. Why is that? Because these are on Oncoscope radar. These are therapies that are not necessarily approved or reimbursed yet or in the guidelines. These are the therapies that have shown positive pivotal trial data and are coming soon. So it is on our radar for the physician users. These are the therapies that are potentially practice changing. But let's reset that for a moment and think. In pharma, we often want to ask the broader question. We don't want to go into a narrow pathway. We are, let's say, developing an ADC. So let's see how many trials there are with ADC. And you could see here on the top, there are 98 clinical trials that reported efficacy for ADCs. Well, how many of them are metastatic? Well, 78. I am searching live right now. I am filtering live the existing database that has been updated daily. So let's explore that, because we want to start wide with our systematic literature review so that we can potentially consider various different subpopulations of patients. We're now on the second screen. That is called study listing. Each study is carefully tagged by an experienced researcher team, and the tags vary from those that specify whether it is in a specific guidelines in the US or in Europe. It also talks whether it is maybe in on the Oncoscope radar, as I explained, or earlier investigational drugs, or it's a failed study. So quite convenient for you. You can also organize your search, and right now it is organized by relevance. Which means is that those studies that are approved and in the guidelines are on top. However, you could reorder the studies and look the most recent by which study had the most recent publication for that. You can also add custom fields. This has been available in Edge for a long time, for example, quality of life. And look, instantly it appeared right here. You can also filter you could select studies that have been presented at various conferences. For example, the studies that have been presented at ESMO. You could see that 17 studies of ADCs were presented at ESMO, and Destiny Breast 09 study is here on top. There was no quality of life data, but we still have this selected. And what if we like the study, we would like to remember that. We can click on that study and download the report, as we were able to do in Edge. So if you need a quick report for your records, and here it is, then you could create this on the spot. It could tell you what were your search criteria, what you additionally selected, and it gives you a summary of the study with all the data already extracted, the data variables that you have selected, and all the references right here in front of you, and they're all hyperlinked. And now to Enterprise. The new addition to Enterprise is a new tab. It's called Data Table. So remember, I've selected 78 studies that were for the metastatic breast cancer with ADCs. So here we are, instead of a list view, present that in the table. All the studies are presented here. And similarly to what you were able to do in the listing view, you can add custom columns, except we are now in pharma, and there is a lot of columns to add. So what if you want to make a specifically table to show the survival? So let's remove the progression. Let's add the landmark survival and OS measure, which may be very important, and the observation time. So you create a custom table right there in front of you, and it's all right here. The table is there. You could view it on the screen, but consider it's 78 study. That's still kind of a pain. So let's see, can we filter that more? Because we are preparing for a specific submission for the HTA. So maybe we don't need all studies by phase. Maybe we only want phase 2 or phase 3. Let's apply that. And we're now at 41 studies. Let's only select RCTs because maybe we're conducting indirect treatment comparison and we want to make sure our network is complete or how complete that can be. So let's apply that. We're only at 21 studies. We could further select within the treatment path. So what if we have an ADC that is for patients that had prior CDK4/6 inhibitor, maybe had prior chemo, and maybe had a HER2 targeted, and then, no, this one is naive, HER2 targeted and prior chemo. So I selected 3 different subpopulations here because this is a later stage, and maybe the studies included all 3. So now that I selected that, I'm only at 9 studies. And here is your complete table. One important filter, obviously subpopulations we could pick as well. Maybe we could select studies that showed a subgroup with brain metastases. But the most important, and the filter I'm very proud of, we're talking about health technology assessment and health economics. So it's extremely important if the studies have been reviewed and recommended or rejected by NICE, by EQUIC, by TLV, and other. We are still in the process of adding. We plan to add all relevant HTAs. However, as you could see here, you could add this and select studies that have been reviewed and now are reimbursed by these authorities. But let's keep it at 9. And if you like that table, because you've selected everything for us, you could just download an Excel report. And in a few seconds, you have the exact report, and here it is, that you've been needing to do, because this is now a database for you ready to conduct any analysis you want. We're in the process of creating a Word report as well. So thank you for that. And I'm so excited to be launching this product.